And we're live.
Good morning and welcome to the Juvenile Justice Reform Council meeting. This is Thursday, August 6th, 2020. It has been some time since we've had our last meeting. It was back in December of 2019. And we are just now reconvening. And so I want to welcome everybody back and thank you for joining us on this live stream. And so I don't want to spend too much time doing introductions. And so what I'm going to do, given our technology challenge, is to just go through and identify everybody that's here in the meeting for the council. And if anybody wants to make any comment, you're certainly welcome to. But let me go through the roster first, and then I will just take a moment to allow our new members to introduce themselves. So we have Mike Stom, Judge Mike Stom, Anton Robinson from Vera. Just, give a wave. Betsy Fox Tolentino, Daniel Zanchetin, Delegate Pippi, Mr. McGlone, Eric F. Thank you, Eric Ford, for putting just your last initial, so to make it more difficult for me. Glenn Fuston, Heather Chapman, Jenny Egan, John Irvin, Lauren Nestor, Luke Klippinger, Lynn Davis, Martin Nelson, Matt Fonseca, Melissa Sickman, Michael Sullivan, Nate Bayless, Nick Conselman, Robert Green, Rosemary King Johnston, Scott Schellenberger, Vice Chair Jackson, Michael Jackson, thank you. And it looks like Betsy's on there twice. I think that I've gone through everybody on the list. And I do want to give just a moment for first, Ms. Egan, if you could introduce yourself.
Yes, I'm Jenny Egan. I'm from the Maryland Office of the Public Defender. I'm the chief attorney for our juvenile division in Baltimore City.
Thank you, and thanks for joining us. And then we also have a new, maybe not a member of the council, but a new participant, Marta Nelson, and she is from the Vera Institute and is taking over for Krista Larson, who apparently found greener pastures during our COVID hiatus. Marta, would you like to just say hello, please?
Sure. Hello, everyone. My name again is Marta Nelson. I'm a senior fellow at the Vera Institute of Justice, and I have the unenviable task of taking over Krista Larson's role here. She is a great colleague and has gone on to other pastures, but I look forward to serving the council in the technical assistance capacity, along with Anton Robinson, who you met last time.
Thank you, Marta, and welcome to our group. Next on our agenda, we have approval of the meeting minutes, and I believe that Jamie Lancaster, who is on the call but not visible, sent minutes earlier this morning. Hopefully you've had a chance to review those, but I'll pause for a moment if you need to review the minutes. And while you're doing that, also remind you that if you want to see any of the events from the last meeting, they are archived and on the DLS website, so you can. I know this is a bare bones look at the minutes, and you can certainly do that. And then after you've had a chance to review those, I'll entertain a motion to approve.
Motion to approve.
Thank you, Glenn. And a second?
Motion seconded.
All right. Any objections rather than asking who's in favor? Anyone object to the minutes? Hearing none, we'll go ahead and approve the minutes. And then we'll go ahead and go into the presentations, starting with Anton Robinson from Vera. Anton, you want to take it over?
Sure. Thank you, Secretary David. Good morning, everyone. I am going to, let me pause and share my screen. Okay. Here we go. So I'm Anton Robinson. I'm a senior planner with the Vera Institute of Justice. I was a longtime public defender in New York and Florida, where I represented youth charged both in criminal court and in the juvenile justice systems of each state. As you all know, I'm with the Vera Institute of Justice, an independent national nonprofit research organization working to transform our criminal justice system in our country. Now, we've been working with the council as technical assistance providers since the last quarter of 2019, the calendar year that is. You might recall our meeting in December where we learned a lot about brain science, but I had the distinct pleasure to speak to you all, the council, about your priorities as an entree into this work. And so we heard themes like reforming juvenile probation, addressing recidivism, racial disparities in the juvenile justice system, raising the age, services for young people and their families. But we didn't stop there. I like to say we went on tour. We did a series of regional listening sessions to sort of gain more information about the priorities of other system actors, family members. And I was blown away to have taken part in so many of them, about 3 of them. I'm gonna show you next where we went. And I know many of you all were there. It was enlightening to have the opportunity to speak to more than 500 people. More than 500 people in the state of Maryland showed up and testified about their priorities, gave really, really in-depth experiences that they've had, their family members have had. Services providers were there, judges were there, prosecutors, defense attorneys, you name it. People showed up because they care about these issues. And so you'll see on the screen now where we went, and I'll just let you see that for a moment. You all know that. But I want to get into what we learned. I think that's the most important part. I'm going to go to my next slide. And so a lot has changed, of course, but no doubt the mission of the council remains the same. So here's a recap of what we heard at the regional listening sessions. We pulled some representative quotes, right? There were a lot of quotes, a lot of ideas and thoughts raised, and we wanted to highlight some issues that we heard about the most. So they're in no particular order, but these were some of the things that we heard as priorities. First, you see probation. So there is a lot of concern about a surveillance model of probation, right? People wanted more services for kids. They wanted probation to serve youth better. And so the representative quote there is from Roseanne from the Metro region, who said, we should move away from youth probation to a model that prioritizes youth development. Moving on to diversion. Essentially, we need more of it. People were wondering of ways to keep thinking about ways to keep youth out of the system. And so simply, Chris said we need more diversion programs for youth, Chris of the Western region. And then there was talk about the minimum age of jurisdiction. So the representative quote there is from Nepali, from the Southern region, who said there's no reason a 9-year-old should be in court. And remaining on the issue of age was youths tried as adults. And the representative quote there is from Ian, who simply said kids should not automatically be tried as adults. And then we talked a little about reducing out-of-home commitments. And so the quote is from Debbie of Baltimore City, who said, we can't just send kids to prisons. And then there was a lot of talk about services. And this was a reoccurring theme all over the state, people wanting more services. So John from the Central region said we should invest in more in-home services. And I think that quote is interesting because the services model that people want didn't stop at serving youth who are already in the system, but they wanted ways to keep youth out of the system, and then more importantly, to serve the entire family. And then I'll end here, and of course, we'll sort of get more in depth as we go further into the other presentations, but there was concerns as well, and I guess opportunities for schools. And so we had a lot of principals, a lot of teachers, a lot of people who work with schools who said we need age-appropriate school start times, right? There's some evidence that starting school later could benefit youth, both in their development in school, as well as keeping them out of the trouble after school. And then more generally, a broad conversation can be had about the school to prison pipeline and violence in schools. So that's just a brief entree. I know you all have access to the videos of the sessions. A lot of takeaways from there. And I look forward to continuing this conversation. So for right now, I'm gonna toss it back to Secretary Abed, and thank you all for your time.
All right, thank you. I was panicking, trying to find the mute button there. And speaking of the mute button, I failed to do some housekeeping items before I let Anton present. And but everybody, I think, has been on these calls enough already that they already know to keep their lines muted if they don't have if they're not speaking. And there is a hand raise function, and I think it will work, and I'll be able to see it even with someone sharing their screen. But if I'm not recognizing you and you have something to say, please just unmute and ask a question, and we'll try to do it that way. If it gets really unruly, then we'll go back to the hand raising thing and try to handle it that way. But before we go any further, let me ask if anyone has any questions or thoughts about the summary of the listening sessions. I know a lot of you members were at various listening sessions, some of you at many of them. You might have some comments that you want to add to that before we move on. All right. I'm pausing just a moment if you can't find that unmute, but I'm sensing that no, there aren't any questions, so we'll go ahead and continue. The next presentation is going to be actually my presentation. Betsy is going to share her screen, and we're going to go through a PowerPoint and see hopefully that this works. And so I'll try to monitor if there are questions as we go along. If I miss them, please, as I said, just go ahead and jump in. But here we go. All right, so what I'm going to do is first go over our COVID-19 response. I'm going to be very brief on this. I have given briefings on sort of the specifics here because I want to spend a little more time with the data and see where that's going, as this is the a policy council. But with COVID-19, obviously, we've had to take a number of measures to mitigate spread within our facilities, to prevent it from getting in, if we can prevent it from getting in the first place. And so we've done a number of things. I don't want to go through all of them, but I will just highlight a couple of things. One of the more significant strategies that we used was to break down into small groups, and particularly in the youth centers. We actually had to bring in additional trailers of bathrooms, full bathrooms that had sinks and showers and toilets, so that kids didn't have to share those lavatories in larger groups, and that we could keep everybody in segregated groups. So that meant youth and staff had to be in these small groups and not commingle, so that if we do have cases that come in, and we are going to have cases, and we've had cases, we want to be sure that we minimize the exposure to others. There is a document that we have on our website that goes into great detail about each of the different measures, whether it's about cleaning or the social distancing or masking, and you can read about that on our website. Let's go to the next slide. So in addition to the facility responses, we also had to respond in the community. And, everybody sort of understands and knows that the facility staff have been just tremendous in continuing their dedication and service to our kids coming to work. And they never stopped operating. Many of us have started working at home. Our facility folks never got to do that, nor did our community detention folks. And these folks are also 24-hour, 7-day-a-week operators, and they often get overlooked. So I want to highlight them. They continued operating in the community, and they were a vital part of our response because, as you'll see in the subsequent data slides, a number of youth were released into the community, many of them on alternatives to detention that were supervised through our community detention operation. So those were very critical operations. Also moving a lot of our supervision and programming to virtual platforms, and there are certainly advantages and disadvantages to that. But again, we have more detailed information on the website on all of these different things that we've done in response. Let's go ahead and go to the next slide. This one I want to spend a little more time on communication strategies. Communications are so very important in the way that we operate. And when we went virtual, it put a lot of strain on our ability to communicate with folks. And we realized quickly that we had to find alternative means. And in some ways, these means were better. And I'll just highlight the staff and the family live stream events. When we're trying to communicate with staff, we typically have to do that in small groups. We used to have an annual meeting, and we could get about 200 of our staff, which is a little bit less than 10% of our total staff together at any given time. That was about the max we could ever do. And so the shortcoming of those in-person types of events is that you can't get your message directly out to everybody at the same time. They're going to have to hear it through the grapevine, through a memo, through other means, or watching video of a conference that they didn't get to attend. Through the virtual live stream events, we can get to hundreds of staff or dozens of families as they log in. We can answer their questions and be responsive, and it's not coming from one of my subordinates who's getting direction from somebody else. They can get those answers directly from me, or if we have a family member that has a question about the healthcare in the facilities, they can get that answer from our health administrator directly. And so everybody gets to hear that message at the same time. So I think there is some advantage to that. And then also, because we archive these things, folks that aren't able to tune in on the live event can go back and watch those things. Or if you just forgot what the response was to something, you can go back and rewatch that. And so these things have been very helpful for us. It's not a substitute for in-person meetings. We don't get the nonverbal communications that you get at an in-person meeting, or the sidebar communications. There's a lot that's lost when we're not in person. So we do want to return to that at some point. But these other strategies that we've developed are ones that we intend to continue using moving forward. Yeah, next slide. And then regard to testing, there's been a lot of moves on testing. Where we currently stand, we have done universal testing throughout the facilities. We have identified some positive cases and had to go back and do subsequent testing. We've done that at the Baltimore City Juvenile Justice Center, and we've had to do we'll be doing subsequent testing again at the Justice Center on Friday. And then Monday again at Waxter because we had positive cases. But we do have an evolving strategy. Every kid that comes in at intake, and we do still intake youth from the community, goes into an admission quarantine unit, and they are tested. If they are going to move from one unit to another, or to another facility, they are tested again. Of course, if they show any admissions, they are tested, and if they are exposed to anybody through a contact trace of somebody else that was that had tested positive or showed symptoms, then they would be tested as well. We are looking at trying to improve our universal testing strategy. We're working with the Department of Health. We've had some issues when you do testing on a large scale in a facility. It's virtually impossible to social distance. So we want to look at how we can take the testing off site for the staff and perhaps use our own staff to do the kids testing and kind of split that up so we can reduce the groups. So there does need to be more work on this. But overall, we've had good results in keeping the virus out of the facility. Most of our facilities had no positive tests through the universal testing. And we'll continue to evolve the strategy as we move forward. All right, next slide. Now we're going to get into the data. And this first slide is just looking at the number of complaints. This is the front door to the system. And so as complaints go, the rest of the system goes. This is our canary in the coal mine. And as you can see, starting in February and moving forward, there was a significant decline in the number of intake complaints coming in, nearly 60%. You can see from May to June, there was an uptick. We were able to get July data in here actually just yesterday. And we see that has, it looks like it's starting to flatten out. Go ahead and go to the next slide. This is looking at our detention population, the average daily population. There are a couple of significant things I want to point out here. The first is, okay, you see the green line, or excuse me, the blue line is the overall detention population. Then you have two lines underneath that representing the juvenile population. That's the orange line. Those are youth that are coming through the juvenile court door. And then you have the adult population. Those are youth charged as adults coming from the adult jurisdiction. And with respect to the adult jurisdiction, you see the number at the end there is 91. That is 20 youth short of what it actually is because of restrictions that we have on transfers and movement. We have 20 kids that are in adult jails that would otherwise be with us. So I want to point that out because that number is low, not because there are fewer kids charged as adults, but because we weren't able to take those kids in. You see the numbers starting to move up. We are bringing them in small numbers, and we do intend to bring all those youth in, so the number will go up. The other thing I think that's perhaps the most significant part of this is the point at which these two lines cross over. And I just want to pause on the significance of that. This is that juvenile line. Those are the kids charged in juvenile court are now a lower proportion overall of our detention population than those that are charged with adults. If you add the 20 back of youth charged as adults that would otherwise be with us, it's almost twice the number of kids charged in the juvenile system. And I think that's a remarkable thing. And it's something I think that we'll come back to, but I wanted to point that out, that our population has dramatically shifted. So we see that shift now and say, all right, if the youth charged as adults haven't really changed, what did change? Well, it was the juvenile population that changed. And this slide that we're looking at is the relative proportion of our population. So when we look at the left side of the slide, you see violation of probation is the gray area there. That was 19% of our population. 30% of our pop was misdemeanors, and so on and so forth down to the crimes of violence, which were 29%. Now, when you look at the right side, that's July 31st, more recent data, and these trends are pretty consistent to today. You see that violations have shrunk considerably from 19% now down to 7%. Misdemeanors have come down from 30% to 21%. Nonviolent felonies, not much of a change, but you see a very large change in the proportion of youth that are detained for a crime of violence. And I think this is perhaps the most important slide, one of the most important slides that we'll look at today, because what it really says is that, if we were to, if we still had our Juvenile Justice Reform Council meetings continue instead of having COVID-19, and we did all the reforms that were being proposed, we would want to see the population break out like this. One would want to see low-level youth leave the system, leave the incarcerated status, and that we would concentrate our efforts or use detention only when necessary for public safety. And then we would want to see, or we would expect to see, a larger proportion of the population be from a crime of violence. So I think this is very important to note, that we had a decline, a significant decline, but that it wasn't an even decline. It was very uneven. In the right ways, it was uneven. So let's go ahead and go to the next slide.
Hey,
So,
Sam?
yes, Scott, go ahead.
Scott Schellenberger. So back to that slide, I'm curious, so that's the comparison of those being detained, but how does that compare to those being charged? So is it that we're holding fewer, or that we're charging fewer and therefore holding fewer? Or do we know that?
It's two things. I mean, we have fewer kids. So you see in the top of the slide, we had 108 youth before in the March 3rd slide. If you go into the July 31st, now we have 43 youth as of July 31st. So the total number came down, yes.
But that's detained. Are we comparing it to charged? Those who are charged, but they're not being detained.
I see. So are we just releasing youth? Is that what you're saying? Are we not just detaining youth that we otherwise would have?
Yes. So are we actually seeing a drop in the juvenile crimes, or is it just a drop in those who are being detained? And if we don't have the answer, I mean, we can put that into the future.
I think we can explore that. If we go back to, I think it's slide 6, you can see complaints are down significantly. So the overall number is down 60% that's the front door coming in. That's a significant decline. What we're looking at in slide number 8 is what's the relative mix of the kids that we are detaining. So yes, the pop is down, and we know that it is down to a large extent because fewer kids are being arrested. Absolutely. But I think the significance here is the mix of kids. Go ahead, Betsy.
This is Melissa.
Melissa,
I was wondering if you have data, do you have a sense of whether there's a change in policing where kids aren't getting arrested as much, or perhaps a change in incidents occurring at schools because schools are closed?
Well, I think you make a good point. With schools closed, schools are a significant contributor to our populations and for our complaints. So, absolutely, COVID has had a suppressive effect on the total population. I don't think there's any question about that. I think the thing that I'm trying to highlight is, while the total numbers are down, what we did in detention was not just a reduction across the board, right? Each one of those cases is a hearing that has a public defender and a state's attorney and a judge hearing the case. And I think that's what is remarkable to me, is that as that population declined, it declined in a very thoughtful way, because it wasn't just like, hey, we need to get the numbers down to whatever number to be safe. There was a prioritization, and we're going to get to that in terms of how we approached it.
Sam, this is Jenny Egan. I also want to interject that there has been a different detention standard since the Court of Appeals issued administrative guidance under COVID, and they issued that in early April. I just want to put that in as a factor as well, that the calculus for when a child can be detained, it has been different since the Court of Appeals administrative decision April 2nd or April 7th.
You're absolutely right. And when we get to the end of the presentation, we're going to talk about what are the drivers. And I believe that you're right on point with that. The modifications to that standard for detention and for commitment, I think are significant, is a very significant part of why the numbers have changed so dramatically. All right, so let me just back up one more, if you can, Betsy, just to the last. All right, so we've seen the population go down. We've seen it go down. Where is going down? It's going down largely through violations of misdemeanor or violation of probation and misdemeanor youth. That's where the decline is happening. And so the next question is, well, what's happening with the kids in the community? We've released a lot of kids. How are they doing? Well, a lot of those kids go on to, if they were detained, they go on to an alternative to detention. And that's where I was talking about our CD, which is Community Detention Electronic Monitoring, is what the EM stands for. And so this is looking at failure to appear. So when we look at detention populations, whether to hold or not to hold somebody, the two issues that the court is really struggling with is, will that person appear in court, and will they commit a new offense while awaiting court? So those are the two measures that we look at. And we see here that there's not a lot of difference in behavior. If you look at March 20th is sort of the date, if you want to draw a line down there, when the population started to decline precipitously. So after March 20 is the dates we're looking at, and we're not seeing new juvenile offenses or a higher rate of failures to appear. Let's go ahead to the next slide. This is looking at youth that are on probation in the community and how many either were violated or the green line is have a new juvenile offense. So that would be, an arrest or a charge from generally from the police. So you see that those have also mitigated. We don't see an increase in the number of violations or new offenses for the kids that are out in the community on supervision. Let's go to the next slide. So now we're looking at the committed population. These are the youth that were already adjudicated delinquent and in a committed placement. We've seen a big decline in that across the board. I'll just note the same factors that are impacting detention population also will have impacts on the committed population. There were kids that were released sooner than maybe they would have otherwise been released. But the other big factor driving numbers down is that there's nobody being placed. The front door is down 60%. That is always going to have impacts throughout the system and continue to drive numbers down. So I would expect to see this number to continue to decline over time. Let's go to the next slide. So this is looking at youth that re-entered. So we did have youth that left placement, re-entered the community. How did they do in terms of new arrests or violations of probation? Again, we can look at the March date as our sort of line of demarcation between when the population started to go down. And again, we don't see much different activity in terms of new offenses or violations. Violations are certainly down, but otherwise, we don't see negative public safety impacts here. All right, let's go to the next slide. When we look at our population, and I want to just highlight a story that came out recently in the New York Times, looking at populations around the country going down. And most of the country saw population decreases similar to ours, not as pronounced in many places, but certainly they saw big population declines. But in most of those other places, and the thrust of the story in the New York Times was that race disparities exacerbated as the numbers went down. And that's consistent with our history. When we look at a lot of the reform efforts that we've done that have been successful at driving populations down, and I'll just use JDAI, not to pick on it because it's been a great success, but as we saw the detained population decline, the detention population for white youth declined faster than it did for youth of color. And that created larger disparities. What we see here as this population has gone down, the race disparities have actually mitigated and moved in the other direction. And here you can see at the beginning, if you look at the bottom of the slide there, The orange color is the pre-hearing detention kids, and then the gray is youth that are awaiting placement. And, 85, 82, 80, always over 80 generally is our youth of color mix prior. Now we're seeing it in the low 80s and in the 70s. So not a huge decline, but that it's moving in the right direction is significant. Because as I said, in other situations when we've seen declines, it's always been faster for white youth than it is for youth of color. This is the first time we've seen it accelerate faster for youth of color or benefit youth of color more than it benefited whites. Let's go to the next slide. This is looking at the youth of color population or proportion in the commitment. So the first one you saw was detained population. This is you looking at the committed population. We're seeing similar mitigations in the proportion of youth of color in commitment. And so, I think these are really important indicators. We've seen declines in the population, but they were in the low-level offense categories. We saw, which is where they should be. We saw race disparity mitigate. These are really, I think, important markers to look at and say, okay, while we did not engage in reforms to get here, to the way that we would sort of traditionally do it, we are here now, and it happened in the way that we would want them to happen in a reform environment. And I think that we need to understand what happened and challenge ourselves to sustain this trajectory. Let's go ahead and go to the next slide. There's been a lot of discussion about what caused all this? And, I think that we're going to hear some and hopefully have some more discussion about what caused it. But Ms. Egan, I think, pointed to perhaps the most important piece, and that was the judicial action. And, the Office of Public Defender made a motion to change the standard, essentially. That's not exactly the motion, but they made a motion to move kids out of detention and committed populations. And the chief judge responded with an order that produced results that reforms would have produced. And I think there are other factors. I think that, another thing that we should, sort of look at or perhaps recognize is that with COVID, everybody, and I mean the stakeholders in these hearings, had the same priority, which is the health and well-being of young people. And so perhaps having that alignment of the same high priority had an impact. I think that's something that we should look at. I think there has been unprecedented collaboration between all of the stakeholders. The public defender's offices, the state's attorney's offices, the courts, and the department have been collaborating and communicating effectively. I think that's been an important thing to recognize and preserve. And overall, I think this is a great opportunity that we have here to understand what happened and keep us on the trajectory that we're on. So I'm gonna stop talking right now and open it up for questions or comments. Okay. No questions or comments? All right, Ms. Egan.
I have a few, as I always do. So the proportion for youth of color is very exciting, but those are only the percentages. Since we're talking about very few numbers of kids, I was wondering if we could see those raw numbers. If 3% only represents 1 or 2 kids, that makes a significant difference. So I was wondering what the raw numbers were on the proportions.
I don't have that data available, but we could probably get that data and provide it to you.
Great.
I was going to just sort of comment the issue of what decisions and how has decision making changed during COVID, and what kind of things do we want to hang on to afterwards. I think your focus, attention to everybody was thinking differently about the well-being of kids. And I think the trick is that post-COVID, there won't be that, oh, the pandemic is unhealthy for them to be in this environment. How do we get people to focus on that well-being? Just being in the system is not a well-being thing. You want to keep kids out. We're involved with folks at Drexel University on a WT Grant Foundation, small little project to look at just that. How has decision-making changed during COVID around detention, commitment, and transfer? And how can we hang on to the things that we want to hang on to that are kind of reform-minded things? So Sam, I might reach out to you and invite you to participate because I think, have looked at it maybe more than a lot of places have. And kudos to you guys for having the data to do that.
Yeah, and I think, Melissa, you're hitting on a very important point there, which is, and I kind of breezed past this, but that this was done by courts. This wasn't done by some kind of fiat or a single person looking at the population and adjusting the numbers. This was done by individual hearings. And so while the standard was adjusted by the administrative order, if you sort of boil it down, it's still really the same analysis in the end, which is we should always be prioritizing the welfare of the youth, right? The law has always said the best interests of the children should be the top priority, and the risk to community safety. That analysis is still there, but they did come to a different conclusion in these cases. And, the way I look at that court order, and I think as we, sort of unpack it and understand it, is the court order really focused judges on these, health issues. But, there are lots of other collateral issues that aren't good for kids by being incarcerated. So arguably,
people don't think
it's
about
the same
normally.
Analysis, whether you're looking at it by COVID or you're looking at it by the flu or any other communicable disease, or the consequences of being incarcerated, the mental health consequences of being separated. They're all the same. They're all consequences. And so I would say that, yes, it sharpened our focus and pushed us to health, but arguably it's the same analysis. And maybe we just came to a different conclusion this time.
I'm going to guess that folks that are more advocates that, like Nate, would say, this is what we've been trying to tell everybody for years, that being in the system is not healthy for kids. How do we get people to realize that in the long term? Our organization, we're a judicial membership organization at the parent organization, and we've spent hours and hours and hours listening to judges talk about how COVID has changed their way of thinking about kids and the system. And I would also point out, and the child welfare system also, that, there may be, for many people, not everybody, but for many judges, there is sort of this switch that has been flipped, at least during the pandemic, of realizing that kids are better off with their families, even if their families aren't perfect.
I want to get Scott in. Thank you for your comments, Melissa. But Scott, you had a comment.
So, I have to inject a little sense of realism here. I have the luxury of looking at both the juvenile side and the adult side. And I have to tell you that COVID by itself has been an overwhelming factor in lowering numbers. My detention center has dropped 400 inmates since this started, and has consistently stayed that way. So I can't believe I'm arguing this, but I do have to interject that COVID has had more of a significant impact on detention than I think all these other factors. So if you all are interested in keeping the numbers the way they are, I think a lot more is going to have to be done because I think COVID is an overwhelming factor in this area. One of the things I had a question about was, I know we're looking at the juvenile system, but do we have a permission or an allowance to look at the juveniles who are up in the adult system? I mean, are the numbers down because the numbers are down, or are the numbers down because they're actually in another system? And I don't know if we're allowed to look at that, but I certainly think, you know, if we have a bunch of 17-year-olds that aren't in the juvenile system anymore, but they're sitting in my detention center, well, I think we got to know about those numbers. So
Yeah, Scott, we took a look at that, and we do have, there are 20 youth charged as adults that would otherwise be in our facilities, but for restrictions on transfers. So if you look at that and add those back into the graph at the beginning, we had 91 youth charged as adults in our population. That would put us back up to 111, which is pretty close to where we normally are. I think
right.
We have a low of about 100, a high of about 120. So 111 is right in there. So those numbers really haven't changed much.
So I might not be articulating myself. I understood that 20 because you mentioned that before. What I'm talking about is the ones that are in the adult system and are staying there. You know, has that number changed, and can that account for the changes that we're seeing?
Okay, so the ones that have either been denied transfer or were never eligible to begin with because of the nature of their offense.
Correct.
Okay, we can take a look at that, and I think okay, it's not going to be as easy as I think because I got to go to all the local jails.
You got to go to 24
Let me pause
places.
on that.
Yep.
We may be able to get that number. We will try to get that number, but I think we would have to pull the local jails to get that.
Yeah. All right. Thank you.
You're welcome.
I want to ask.
Nate, go ahead.
Yeah. I mean, one question I have, seeing Eric here just reminds me of it. I'm curious, in discussing both the population drop across the board and sort of looking forward, the role of community partners and programs and services in sort of building off of this, and both sort of the role they've had thus far during the pandemic and what that can tell us about moving forward, the sort of importance of programs like Eric's, but others as well, in as how youth justice moves forward in Maryland.
Yeah, I want to actually kick that over to Betsy. I know you're writing, Betsy, but she's been working very closely on a number of things. One thing is streamlining our intake process, utilizing our diversion programs. And I think one of the most important things was to take all of the programs, like Eric's program, the Choice program, and instead of only making it available to youth that have gone through and been adjudicated delinquent, we can make those things available to youth through diversion. And especially when you look at the trajectory of so many of these cases, you know, they get detained, they get held in detention for you know, at least a couple of weeks. They get adjudicated delinquent, and then they're put on probation in the community and put in a program like Choice. Well, if we know that's likely to happen, then we can certainly take advantage of our diversion authority and put them in those programs to begin with. But that's just one component. I think, Betsy, can you talk about some of the virtual programming and the enhancements?
Yeah, so at the beginning of the pandemic, we had to quickly shift how we were supervising young people in the community. One, we didn't want sort of community supervision or their probation to just stop over the pandemic. We wanted to be able to have kids continue to be able to move through the system. And in order to do that, we needed our community-based organizations like Choice and YAP and others to change how they were doing business. And they did incredibly fast and were able to serve our young people in the community through virtual methods. And we also had the opportunity to survey about 300 families to sort of get an idea of how this virtual programming was working for them and how virtual contacts with your case manager was working. And overwhelmingly, our families felt that this was a great way to communicate. And through focus groups with our case managers, they really felt that they were almost able to develop more meaningful relationships with families and young people, because having this conversation over like FaceTime or Skype or whatever, is it just takes out a little bit of the, power struggles that may exist when you have someone coming into an office that's in a courthouse. And, this allows for a more, sort of casual conversation to really get in and get to build trust and relationships. And then we also transferred our focus not only to connecting young people and their families to the community-based organizations that can support them, but also sort of those other things that are happening as a result of the pandemic. So we knew that some of our families may be struggling with food insecurity. So we wanted to make sure that we could be that connector to community-based supports that can help them with those issues. But I have to say our community-based organizations, they completely just came to the ready and to support our families. I just want to give one example with our family peer support program, which is run by the Maryland Coalition of Families. And we only have this program in 6 jurisdictions around the state. We're planning on expanding to be statewide, but because of virtual programming, we became statewide overnight. And so we had families that were in need of peer support that were in a jurisdiction that didn't currently have that service, but we could connect them now because we took away that barrier of having to travel 2 hours to get someplace. And our Coalition of Families peer support specialists did such innovative programming, such as dropping food off on the front porch of the house and then doing a virtual cooking class with the family and the young people. The same goes for when we talked about, sort of the listening sessions around the state. One of the things we heard in almost every listening session was there was some sort of service missing in the continuum that was available to that community. And virtual programming helps us sort of overcome that barrier. And we were even with, a very generous support from the Annie Casey Foundation, able to help our families who didn't have access to digital, Wi-Fi support. We were able to get them that support. And so as, the state is sort of transitioning to make Wi-Fi connectivity more available to everybody so that we can stay connected, we were able to bridge that gap with help from Annie Casey. So I'll stop there. I could probably talk about this for way longer.
Betsy,
And
I
the way
have,
that,
I have
I'm
a
sorry.
follow-up question on that, just because I think it seems so critical that the drop in violations is some of the huge gains that we had. Do you think there's a link to removing the barriers related to transportation and reporting in person, giving devices and having kids have virtual access, and the huge drop that we see in violations?
100%. We are having way more contact, in a sense, with our young people and our families, and almost, and we'll all say this even about our jobs, we're a little bit more on demand, right? So if there's a need, we're able to do that immediately. And that's huge for young people who are making second, decisions, to be able to reach out to someone who can provide them support right away. So absolutely, Jenny, I would say yes.
Yeah, and you see people not missing meetings or not missing court because it's virtual court. And I do think that, with probation meetings in a building that also houses the court in which they were adjudicated, probably isn't real fun for kids to come in and visit. And so I think there is certainly less anxiety and bad feelings when they're doing a virtual visit. I think it brings the temperature down. It lets people just see each other as human beings, which I think is really important.
Hey, Sam.
Yes, go ahead.
This is Glenn. I just want to point out and give some kudos to you and to your team. I think this has been a great dialogue. It's been a great presentation. But what might not be so obvious to people, and correct me if I'm wrong, is it's all driven by the data that you've been able to amass and be able to have this discussion and show where we're pushing and where we're not pushing and where we need to change things. And I just want everybody to be reminded, and I'm sure everybody knows, that is very difficult to do sometimes, to get that data. So I think that as we all talk and as we're all thinking about from our own perspectives, however we can make this data available to this group as a whole, to continue that conversation and see where we need to push. In my opinion, it's not a gotcha moment or anything to that. It's hey, this is where we need to push a little bit harder. This is where we're doing a good job pushing. I just wanted to put that out there, and the leadership of your team and for this council, I really appreciate it. And I apologize for my camera going in and out like it's pulsating. But thanks.
That's okay. All right. I'm going to let Secretary Green one more, then Delegate Pippy, and then we need to move on so that we can get Nate's presentation going. Go ahead, Secretary
I just
Green.
wanted to compliment you on the virtual presence. I think one of the greatest outcomes is what we have discovered, and with families, people, courts, communication with those that we have in our systems. This idea of pushing the envelope of virtual presence, tracking it, looking at the data pre and post, is incredibly rewarding, and has been something that I know you will continue, as will we, in looking at how that flows. But your work there, incredible. And we have seen absolutely similar input, similar connectivity in helping people and connecting families and connecting courts and connecting, being innovative in how we connect people. So thank you very much, and kudos to you on that.
Thank you, Secretary Green. Delegate Pippy.
Sure, thank you. You know, a lot of members kind of alluded to this, and I think State Attorney Schellenberger alluded to it as well. You know, so we've seen a reduction in population, possibly a reduction in intake, but is there a reduction in crime? I mean, I know that COVID has a major impact on literally everything. I mean, there's a reduction in people staying in hotels, going on vacation, going to restaurants. So my question is, you know, is there any data to suggest that there's actually an equal reduction in crimes either being committed or the reporting of crime that would match the reduction in numbers of folks going in intake or going into incarceration? And then the other thing, for that reduction, is there any data that would suggest that there's going to be an equal reduction in any recidivism, you know, for these individuals? Because obviously, you know, we do have a responsibility to ensure that people are getting any rehabilitation or any services that they may need, you know, to live a productive life. But if they're simply just not being charged or not entering the system, you know, do we have any idea, you know, what sort of impact that'll have down the road? And so that's what I would want to see. I mean, in a perfect world, there's a reduction in everything. There's a reduction in intake, a reduction in incarceration, a reduction in crime, reduction in recidivism. But all I'm hearing is there's just a reduction in intake and incarceration. And that's likely because of COVID, just like it impacts every other industry, you know, in our society. So that's all I had to say about that, and appreciate you putting this together, Stan. Thanks.
Thank you, Delegate Pippy. I do want to respond to the recidivism piece. We are tracking, and in our presentation, we do have data. It's monthly data, and obviously recidivism is generally, you know, we do it in a, you know, 6-month or 12-month or 24-month interval. So it is, you know, we only have a few months of data right now, but we do have new arrest data. So kids that were released, we are tracking if they get arrested again, and we're not seeing an increase. There has been some decrease, but I think it's too soon to say that there's a sort of impact here, you know, from that. What I'm saying is that we have not seen an increase in the number of recidivists, if you will, kids that were released that committed a new offense, whether they were released from, you know, a committed placement or released from detention. You know, in terms of the question about overall crime, you know, I think that one is far more difficult to answer. I think we can look at, you know, we certainly know juvenile arrest rates are down. So fewer kids are being arrested. That's what that intake number is showing you. We don't control the intake door. That is essentially the arrest door, or I should say the charging door. They don't have to be necessarily arrested. You can just be charged with a crime. And those numbers are down almost 60%. Now, I think the only thing you could really look at if you want to see if crime is down is reports of crime, and trying to understand if the total number of reports of crime is up or down or flat. We could certainly look at that, but then it would be, I think, virtually impossible to determine, are those crimes being committed by adults or juveniles, if we're looking at overall reports of crime. So I think there's some pieces that we can look at, but probably not the whole picture. But we have a data expert in Dr. Sickman, who might be able to give a little bit more on that
Yeah,
answer.
I mean, it's perpetually frustrating. There is really no, good measure of a juvenile crime rate. We have crime rate numbers, but you don't know whether it's a juvenile or an adult till it gets to arrest. And then the rest is also influenced by police behavior. So the trick is to figure out, has the behavior of kids changed? Or is it just the behavior of different components of the system? I was going to ask Sam, does Maryland do a victimization survey modeled after the National Crime Victimization Survey? Because there would be, at least for the violent offenses, an opportunity there where you're interviewing households to see if there have been victimizations. And then if it's a person offense where they had interaction with someone, whether they thought it was a kid or an adult. That would be the only thing that I could think of. BJS does make the survey instruments available, the methodology. So if states want to do that on their own, they can.
I don't know. Maybe Glenn may be able to answer if we do those routinely in, I suppose with police would have to do the victimization surveys and
No. It's usually done by, the Statistical Analysis Center or university or whatever. It's survey methodology is what it is. So, talk to your Statistical Analysis Center folks and plant the seed of the idea in their head.
Secretary, I just wanted to interject to address this point briefly, which is that what State's Attorney Schellenberger and Delegate Pippy raised. One thing that wasn't addressed is that the youth charges adult population has stayed steady during an extended period of more than 5 months. So what that does tell us is that you would think there are no transfers and no trials happening during that time period. So the fact that that population has stayed the same, even though those cases have not been moving, I would like to see the overall number of kids who were tried as adults or charged as adults. But given that that population has stayed steady, while the courts have not been operating, actually tends to show or may indicate that there is a huge drop in those numbers as well. And so rather than looking at average daily populations, we should be looking at the overall numbers. What the ADP shows us, if it's the same as it was 5 months ago, and there have been virtually no transfer hearings have taken place during that time, it might show us that there is actually significant drop.
Yeah, you make a good point, and the numbers staying the same is probably an indication that numbers are down. What we don't have is the intake flow for youth charged as adults, because that we're not just tied into that. We only get noticed when there's a hearing to move somebody down or so forth. We don't know the entire universe, and that's one of the data points that we need to clean up so that we can know what is the whole universe of folks that are being charged as an adult. And so this is just admittedly a snapshot. It doesn't give you that full picture. And that's something that we could develop. There was one other comment, but unless it's urgent, I would like to move on so that we can get to Nate Bayless's presentation. And so since I'm not hearing anybody protest, I'm going to go ahead and turn it over to Nate to give the national overview.
Great. I hope people can see my screen. Can I get a thumbs up if you can see it? Okay, great. Thank you for this. It's a pleasure to be able to present here, and I'll try not to take too much time. So what I really wanted to do is be able to give some sense of, we're digging into what's been happening in Maryland during this time, what's going on around the country. And I just want to start by saying, I think a concern that I know I had from where I sit when the pandemic started it would be hard to raise attention about what's happening with young people in the youth justice system, because everyone was so consumed with the pandemic and with closing schools and with everything that was going to be happening as the country shut down. I think what's been encouraging is in a incredibly crowded media environment where people are focused on themselves and so many other things happening, that between the pandemic and the heightened awareness and movement for racial justice around the country, that rather than muting a focus on youth justice, it's amplified it. And I just wanted to put up these headlines because these are not local newspapers or, you know, criminal justice focused media sources talking about juvenile justice or talking about kids in custody. These are national publications that are focused on young people in the juvenile justice system around the country. And I think that it only underscores the wisdom of having a Juvenile Justice Reform Council here in Maryland. It underscores the importance of all the questions that were just thrown out there and what we're talking about right now. And so I just wanted to put that out there that this is getting attention. And it's not just getting attention on the local level, it's getting attention as people around the country are asking big questions. And I want to start, you know, the first slide. This is information, as I put at the bottom of the slide, that's being aggregated by the Sentencing Project. And what the Sentencing Project's been doing is they've just been taking information from news stories and from public data sources that have been made available by state agencies and local agencies around the country. And they're reporting on what's been happening with positive COVID cases. We heard a bit from the secretary earlier about Maryland specifically and what's being done. I just have to say, I've been seeing these data daily, essentially, as this is being tweeted out on a daily basis. And it never stops being striking as I see this and imagining what this actually means. And knowing that it took, 4 months to get to about 750 positive cases that were reported nationally, it took another month for that number to double. And this is in a time when we're talking about the number of kids in facilities going down. And so I think all this, as you see on the chart on the right side of the screen, it's showing the cases by week, and you can see the increase that's been happening over the course of this month, that the stakes are high. I mean, I think I really appreciated the conversation that just happened. We had, no shortage of reasons why we should keep young people far, far away from detention centers, from youth prisons, from residential facilities whenever possible. There ought to be a really good reason why we're going that route. That's before the pandemic. Now I think we see even more of this. And I like the way that conversation was happening, that, we already knew that the risk of incarceration for young people, for the vast majority of young people, far outweighs the risk to community safety of having them back at home for most kids. And yet it never gets that kind of awareness. And it seems like the pandemic has had the impact of having people see that in a way. And if that's true, the question is, how do you build off that? The rest of the slides, and I'm trying to run through them quickly, are going to be about some work that we've been focused on at the Andy Casey Foundation. One of the things that we wanted to figure out of how we could contribute nationally during the pandemic was to look at what's happening in juvenile detention centers specifically, local detention centers around the country during this time. And so for the last several months, we've been surveying juvenile justice systems all around the country. And we've been really encouraged by how much data we've gotten back. We're asking pretty simple questions, but it's been great to see what we've gotten back. We're getting data from jurisdictions that cover about 35% of the youth population in the country. So it's a lot of places around the country. And what we're seeing is a few things that I think really you could see where Maryland fits in there, and I'll try to comment when that comes up. The first is that the number of young people in detention, and the latest data I have through this is through June 1st. We have the next round of data that covers the month of June into July, but we just haven't finished the analysis, so I can't report on it yet. But as we look at this, what we see is 27% decline in the number of young people in detention between March 1st and June 1st, but an increase between the beginning of May and beginning of June. Not something that we were seeing here in Maryland in the same way, but something that we were seeing nationally. And I'm going to sort of dig into that a little bit. And I apologize for rushing through, but I know we have a lot other things we want to cover in this meeting. The interesting part is usually we would be celebrating a 27% reduction in the population because that's unthinkable to happen in just a few months nationally in this way. But there's been a 50% decrease in the number of admissions to detention during that time. And usually those two things tend to go hand in hand. When you had a really large decrease in admissions, you would want to see a similar decrease in the number of young people in custody. Of course, the population of kids in detention depends on two things: the front door to detention and the back door to detention, right? It's not just how many come in, but it's then how fast that they get out. And so the next thing I want to show, so this is remarkable of seeing this. This is admissions per day across all those places. And you can see that in February, it was over 200 a day. When you get back down to May, you can see how low it's been. And the fact that that was sustained over April and June is really remarkable, that admissions are down that much. Again, this isn't just covering one place like Maryland or one city. We're talking about, this is across about 160, 170 data reports covering well over 30 states and covering, again, 35% of the youth population in the country. But the release rate, and I think this is just important because it's like one of those mathy kind of things that might be hard to understand, but the release rate is essentially the percentage of young people who spend a day in detention in a month who get out during that month. So if there were 100 young people in detention in the month of June and 50 of them get out, then the release rate was 50% during that month. It's just an easy way of kind of understanding that information. What we saw nationally was in March, as the pandemic hit, as the nation shut down, that there was this jump in the release rate, that there were lots of juvenile justice systems around the country that in a variety of ways were saying, whoa, we really need to look closely at who's in detention and get kids out who we can get out because of the pandemic, and knowing what could happen in jails and detention centers around the country. What's been concerning, though, is ever since then, the release rate has dropped, and it's dropped by a lot around the country. And what we see with that then is it's down by 22% or 14 percentage points during this time. And just to give a sense of why that matters, this is trying to show, here's what the green bars are the population that I just showed, that we had this 27% decline in the number of kids in detention between March 1st and June 1st. This is showing what the population would have been. The orange bars are showing what it would have been if we had kept at that same release rate that we had in March. We'd have a third fewer young people around the country in detention if we had just been able to sustain the same release rate that we've already shown that we could do in March. And the point of this is not that it's easy to do that. It's not that there aren't good reasons, as we understand that it gets harder the fewer kids that are in detention there could be. It also, though, allows for the opportunity to, as we're seeing in Maryland, that you can review every case more easily, that you can dig into it, you can get more creative on how you get young people safely out of detention when there are fewer kids there to make those plans for. And so this is really a concern in some ways, that as we've seen that front door close to detention more, the back door also seems to be closing, and we need to be able to get young people out. I think the issue of court that we're hearing about here in Maryland is something that's very real, and something that potentially, if court was meeting more, we could see the potential of many more young people getting out when they can and when we can safely do so. The last thing I want to say on this, because I'm really glad it was part of the Secretary's presentation earlier, but is then let's talk about race. Secretary referred to a New York Times story that was really quoting these data. And what we saw, what we've seen around the country is that during the pandemic, racial disparities among young people in detention have gotten worse. Meaning specifically, if we look at this chart, that the percentage decline in the white population in detention is slightly more than the decline in the Black youth who are in detention. 27% for Black youth decline, 30% for white youth. But the reason why that's so disconcerting is the last chart I'll show, which is that the decline in admissions has actually been greater for Black youth than it is for white youth. And I think this is really where, when we think about this in Maryland and seeing some of the success that's happened, and I appreciate that DJS isn't necessarily trying to take credit for the change while acknowledging the change, is to really understand, why is this happening? Why are we in a spot where we're seeing nationally admissions being down by slightly more for Black youth than white youth, but the population is not down by as much? And that, of course, means this is all about releases. And Black youth are getting out of detention more slowly than white youth. And there can be all kinds of reasons why that's happening, but the need to address it, especially in a time where all of us are more focused on racial injustice in all sectors of our country, but specifically in the justice system, that for us to be able to really scrutinize what we're seeing in these data and say, how does this look locally? What does this look like here in Maryland? Or what does this look like in Baltimore County, where I live? Like, being able to do that at the local level is really, really important if we're gonna understand post-pandemic what we're doing as a juvenile justice system. So I will stop there. Again, I appreciate the ability to share all this, and if there's questions, I'm happy to answer.
All right, any questions for Nate? Melissa?
I do have a question just in terms of when you guys are collecting those data, do you have any offense detail at all?
No, one thing that's been the balancing act we've had to do has been, our goal was sort of to get as much as we could, you know? And so even disaggregating by race, just to give an example, again, just to show you like how far we still need to come, and I know I'm not surprising you, Melissa, with this, is that when I said the data cover about 35% of the youth population around the country, data that the places that reports that are disaggregated by race cover about 27% of the youth population in the country. In other words, not even all the data we got from these places could disaggregate their data by race, something that has been a hallmark of juvenile justice for so long, and yet places aren't all able to do that. But I think it's a really good question, because I think what we were able to see in the report earlier from DJS is critical to understand what's actually happening. Like, is this just across the board, kids getting let out of detention or not coming in? My guess from working with these jurisdictions around the country is absolutely not. This is not a jailbreak in any way. This is not letting all the kids out, that this will be, that juvenile justice systems are risk averse in a million ways, and that this is about being more discerning of who's coming in the front door, just like we're seeing here in Maryland, and about making sure that when kids can get out, that they're safe when they're going.
Yeah, I mean, it's no surprise to me the difficulty of getting race data from everywhere. Believe me, I know about that. I mean, I think Maryland, probably you can replicate the presentations that Nate has showed, but then also do it with the offense detail, because I think that graphic, Sam, that you had with all the little people shows, well, if the people that are really passing that barrier of admission are now way bigger proportion of violent offenses, that may explain why they're staying longer, because there's going to be a greater reluctance to release them. And, you know, that there may be also some explanations of some of the race disparities too, because if your minority population is concentrated in an urban area, if that urban area sees more of the violent stuff, then it's gonna be skewed. But that would be some interesting stuff to look at. And then I also, you know, how courts have functioned could play a little bit of that too. You know, if courts in urban areas that have a concentration of minority population have somehow not managed to go virtual as quickly, or have, you know, had some kind of slowdown in their processing of detention hearings differently than suburban communities, for example, that could play into it. You know, when we were talking about the failure to appear, I mean, that was the first thing that I asked, well, what happened to your courts because what, did they close down for a while? When did they go virtual? And the ability to have virtual stuff, so that I think those are like odd data points to bring in to help tell the story, so that you have a better understanding of what's going on in Maryland, at least.
And one thing I will say is that, we in collecting these data, we have only been sharing them back publicly in aggregate. And that was another way of getting them from people. So we're not going to tell on people who are having trouble with this. But we've also been giving back to each jurisdiction their data in with these kind of analytics. And because I'm doing this presentation, and I know DJS will be okay with me saying this, the point I'm making about the release data and the disparities, one of the things that has, at least through the months that I was just showing, DJS, the opposite thing was happening, which is that the release rate for youth of color in DJS was actually slightly higher than it was for white youth, which again helps, I think, explain some of what we're seeing before. It's, I know for me, as someone who is focused on how do we have solutions that can keep young people away from detention centers and away from correctional facilities, it's that front door that I'm always like mainly thinking about. And yet I think I'm sort of emphasizing this about the back door because it's something that's less exciting to think about, which is like, okay, they're already there, how do we get them out? And yet I think it has a huge impact on the population. And we are seeing, like in Maryland, that's been more successful, and that hasn't been a source of increasing disparities, but rather the opposite.
Well, yeah, I think that's super, super important. And it kind of gets back to some stuff that Betsy was talking about before. If you're able to have supports in the community for the families for things like housing and food that may be sort of conditions that are, troubling, that may end up kind of exacerbating the kids' lives in a way that they might offend, that's all the better. The national data collection will have some COVID items, so I hope you all respond to that.
Thank you. Yes, and Melissa, I don't mean to cut you off, but we are moving on to some time situations. So we're going to have to go forward to the next part of the presentation. But I think that the questions that you're asking are questions that we want to talk about. And those are the sort of research follow-ups that we need to do, or at least talk about whether we do those things here in this council. And that's where we want to go next with Marta on next steps and issue development.
All right, so I'm going to share my screen, hopefully successfully. There we go. Okay, hello everyone. So that was a very interesting discussion, and I think we've started to touch on some of the things that we will continue to talk about through the rest of today's session. But I'm here to tee up a discussion about where we go from here. We have basically 4 months until December, and technically under the legislation that created the council, the council was to present recommendations to the legislature and to the governor by December 1st. So I think again, this will be an area of discussion, but if we are to be responsive to that original directive, we have some work to do in the next few months. And we're of course all aware that there was a rather big hiatus for the council's work while DJS and so many of you here dealt with the real-time issue about addressing COVID and how to safely respond to COVID and how to safely reduce the population in DJS detention and commitment facilities in order to keep kids safe. So that was a very, very worthy pause. But here we are with just a few months to go, and we really sort of have to focus on what we can do in the next few months and what we might want to put over for perhaps another iteration of the council. So based on what we heard during the talking sessions, we have some options, and of course from where we are now, that I want to lay out. But then this is really a facilitated conversation amongst council members, because this is your council. We're the technical assistance provider to the council as a whole. So we will respond to what is the will of the council in terms of what to concentrate on the next few months. And and the form of that concentration can be presentations, data, best practices that Vera can bring to the table to help bring together some decision-making around recommendations. Different options that the council could take up. One is what we've been talking about since Sam's excellent presentation, which is how do we keep the progress that's been made because of COVID for secure commitments and detention, learning from the COVID release. So as Sam put it, where we are now could have been the result of some reform proposals that this council may have come up with. We are already there as a result of COVID. So how do we keep it going and perhaps increase the amount of decarceration, which is really what it's been as a result of COVID. Second is expanding diversion. So we certainly heard within the listening sessions that diversion was a request of many people there. I think diversion, we've seen fewer intakes into DJS, so we've seen sort of on the ground diversion in the last few months, but how do we keep that going? Are there changes that we need to make to DJS's authority to do diversion? Is there more services, or is there just different practice as we've seen already in place in terms of bringing in community groups earlier in the game? Next item is probation, and certainly one legislative discussion that's been ongoing is about how long probation can be. Maryland has unlimited probation term, and that is not the case in other jurisdictions. So is that something that there might be some recommendations developed around, as well as some other discussion about how probation can manifest itself. Next up is changing the minimum age of jurisdiction. You heard this in the listening sessions, the quote about why is a 9-year-old arrested and in detention, that we heard throughout the listening sessions. And that again is something that perhaps could be, there could be some coalition around in the next couple of months. And finally, the issue about young people charged as an adult. So there's several layers to this. One, of course, is what the charges that right now require for young people to be charged as adults. There's a number of them in Maryland, and also the issue if that's sort of a big thing to take on in the next few months. There's also issue about those young people who are charged and what are the rules that affect their ability to be released and to be processed that are different than if they were in the juvenile system charged as juveniles. And as a result, they are, as we see, spending longer in detention. That's that number that didn't really change much over the 5 months. And are there changes that can be made to speed up the process by which they can be processed and released? So those are options that we've culled from the listening sessions as potentially things we could coalesce on in these next 4 months, but this is your council, and I'm going to stop the screen sharing and really want to facilitate a conversation amongst all of you. I think, as just a technical issue, you're showing up on 2 different screens and gallery view. So I think it's worked well thus far to people to just raise their hand if they want to speak. I'll be toggling, and Anton will help me between the 2 screens so I make sure I don't miss someone. If you feel like you're flailing and I'm not calling on you, you could also use the chat function down here where you can just type in like, please call on me, I have something to say. If you don't want to say
Marta, before we get to the questions, and I see Scott has got his hand up, so we could recognize him first. I just want to let everybody know that we're going to do a survey monkey of all the options so that folks can vote on it. We don't want to do that today because we're presenting them to you today. I think what we'd like to do is see, is there anything that's missing from that group of options that we need to include for the survey monkey? I think is the highest priority rather than, should this be on the list or not? So if you think there are other things that need to be included that we need to evaluate, let's try to take that up first.
Can you put the list up again?
Sure. Okay.
And Scott, did you have a question that you wanted to ask?
Well, I just wanted to make sure that when we're zeroing in on these particular topics, for instance, I have heard anecdotally throughout this process, this infamous 9-year-old who's been detained. I'd really like somebody to show me where that happened, how often it happened, and what exactly happened. Because, I just keep hearing about this 9-year-old who's being detained, and I just like to know, facts around it. And that kind of goes into my next one, and that is changing the minimum age of jurisdiction. We get numbers, but we don't get facts. I mean, you can come out and say, we had 50 16-year-olds charged with robbery and they're being held as adults. Well, there are robberies and then there are robberies, and so I think we can't just, and I know this is going to be difficult, but I think we can't just rely on pure numbers. I think we have to dig a little bit to know a little bit more about the cases. And I'm just not exactly sure how to do that. I like these options. I think this is a really good place. But I just think there's a couple places where we need to dig a little deeper, and I'm not exactly sure how we do that.
Yeah, so let me clarify one thing. So these are options for us to look deeper at. So for instance, let's pick on minimum age of jurisdiction or of detention. So if we said, yes, that's one we want to look at closer, then what we're going to do is have Vera then pull together the information and give that presentation. So I think what we need to do, perhaps two things, and you've raised a good point, Scott. Number one is picking the priorities of what we want to hear more about, and then number two, what information do you want presented along with that? So I think we'll probably have to try to adjust our survey questions so that we can capture both and have that. And so the idea here is we'd like to tee up some things for the next meeting for us to actually go in depth on. And then at the following, at that following meeting, we can have those discussions. But the reason that we want to sort of stop right here and look at everything is we need to be able to tee up all of those discussions for the rest of the year, because we have such a compressed schedule and Vera needs some time to gather that information. And so that's really the purpose here is what do we want to focus on? And then what information does Vera need to get so that we can have that proper conversation about the policy?
Thank you. I think that's fair.
All right.
Okay,
one sort of maybe additional thing, and I can't really phrase it as a recommendation yet, but I attended the sessions on the Eastern Shore, and there was a lot of discussion about kids and schools. So, maybe at least some recommendation that there be some analysis of the data for the agency to really explore whether schools are really a big driver of kids coming into the system, and what are ways that the state can, kind of cut off that school to prison pipeline, so to speak.
Okay. Jenny, did you have your hand up earlier?
Yeah, but I believe Rosemary and Lynn haven't gotten to speak, so and they had their hands up. So I defer.
Sure, Rosemary. You're muted, Rosemary. Can you unmute? I still can't hear you.
Let's see, I've unmuted, so it should be working. Are you able to speak? No, I don't think we can hear you.
I can hear you. You could try, Rosemary, you could try maybe putting your comments into the chat. Okay, well, I'll go on to, while you have a chance to type, why don't we go on to, who was the next person?
I thought it was Miss Davis, but I was mistaken. She was just moving. So I'm happy to ask a couple questions. From the listening sessions, one thing that you have listed expanded diversion, but there was a lot of feedback about quality programming and the provision of quality services. So I wondered if we couldn't change that focus to services and service provision, because often the expanding service provision expands the diversion potential. So I just wanted to note that there's no focus here on improving the quality of programming provided to kids.
But I take it that's not an either or, because the diversion issue could also be more of a technical thing. Okay. Melissa.
Does Maryland have any requirements around evidence-based programming and practices? That might be something to consider. To require that if there's going to be state funding for something, that it be able to be demonstrated that it is evidence-based, effective programming.
We don't have, I don't believe, that requirement, and it's something that we can certainly look at and put on the list. I've always been a little reluctant to say it must be evidence-based, because there are a lot of programs that haven't reached that standard that do really good work, and I don't want to just stifle them or cut all their funding off completely. But I do note that the Family First Act very strongly pushes us in that direction, and we have advised all of our partners, our private partners, that the 50% reimbursement is looming, and with budget constraints, that is probably going to be a requirement. So the budget may force us there where even language may not.
Yeah, you might want to look at what Nevada did. Their evidence-based matrix that it's kind of modeled after what SAMHSA or CDC has is actually pretty forgiving, at least initially. So it's not like programs are going to get their funding cut off immediately, and at least as far as I know, hasn't created huge problems for them, but has a focus and training for folks on what it means to be evidence-based and collecting data and stuff.
Great. So I see Heather has her hand up. I just wanted everyone to take, before that, just look at the chat where we got Rosemary. We got Rosemary's voice in about education being an important consideration. What happens before youth come to DJS, what happens while they're there, and what happens when they return again. So I would say that's an overall comment about the educational services that are provided to youth pre, during, and post. So Heather.
I just thank you. I just wanted to respond to that piece with the evidence-based piece. Wanted us to consider, as we're having this larger conversation, and don't want to get into the weeds too much, but with the evidence-based piece, just for us to consider being broader. So when it comes to using best practices, definitely promising practices and different things like that, but also understanding that we do have some wonderful practices in Maryland that aren't necessarily best practices, but we've seen producing some incredible results. And also understanding that there are some practices that are best practices that aren't necessarily culturally sensitive. And we need to take that into consideration in this, as we're looking at equity. And so just really thinking about that piece.
Thank you. That's a very important note. I'm just going to go to the other screen. Okay, Delegate Pippi.
Sure, and just to kind of piggyback on what Nate said earlier about, typically, we focus on the entrance into these facilities or the programs, but we don't always focus on the exit. And I think part of that depends on the quality of services that the youth are getting along the way. And so if there's going to be an effort to have more divergent programs, or in lieu of incarceration, shifting youth, kind of taking a risk really and shifting youth into divergent programs or different services, we have to make sure that those services have stepped up. I mean, we can't just shift more people in there without knowing the quality, that they're going to get along the way, because we'd be just wasting time. I mean, we wouldn't be doing these kids a service long term. And so I think if there is going to be any focus on shifting youth from incarceration to diversion programs or what have you, there needs to be an equal focus on the quality of services they're getting along the way to ensure that, again, we're not wasting time and we're doing them really a disservice. And that goes back to the recidivism point that I brought up earlier. I'm all for it if it's going to equal the result we want, but I'm not just going to wing it. Now, the good news is I think COVID's probably going to give us a good example of what happens when less people are incarcerated, because for the first time in a long time, we've had a major reduction in either people coming into the system or incarcerated for whatever reason, right? So we'll be able to kind of study that to see, what the long-term effect is. But I think we really need to focus on, back to Rosemary's point in her chat, about the quality of the services they're getting along the way.
So perhaps, Marta, that would be a call to add data or outcome data on diversion programs to any presentation on expanded diversion, so that we can see how those diversion programs that would be utilized are performing. And we do have some analysis on that we can share.
Great. Okay, we have Melissa. Let me just check my other screen. We have Ann West, but that does not look like Ann West. The person who is whose screen says Ann West. I'll have you go first.
That's Chris West.
Oh, okay, Chris West.
My wife's computer, I'm afraid. And I apologize. I clicked on the wrong YouTube connector, and I've spent the entire time just as an observer until 5 minutes ago. I realized I wasn't even here. So, but I have been listening. I go back to a conversation I had with a fellow, I think he's on screen, who had been in the juvenile justice system. And after the first meeting, he and I had a conversation, and he complained that the education that's being given in the detention facilities is college track education. And he said this really isn't helping the people in the facilities, because it's unlikely that many, if any of them, are going to go to college. What they really need is education which would equip them to get jobs in the real world. I think that's sort of along the lines of diversion and how we can have quality work in the system and then get people out. So that's one thing I think we ought to take a look at. The other is I've heard a number of complaints that the foster care system is the populator of the juvenile justice detention system, and that a very high percentage of juveniles in the system come from foster care. It may be too much for us to take a look at, but it seems to me sometimes some group has to take a look at the pipeline and where the juveniles are coming from. And in fact, if they're coming disproportionately from the foster care system, what should we do about the foster care system to prevent the kids coming out of the foster care system simply upstreaming right into the juvenile justice system? So those are my thoughts.
Thank you. Okay, anybody else on this? Okay, I know, let's hear from Nate first and then Melissa.
I saw Heather too, so I don't know. Heather, did you want to jump in before me?
Okay, Heather?
I think I just wanted to piggyback on, I know Rosemary mentioned before the importance of education. So while we're talking about, I think, the intersection of systems, just understanding and circling back to the education system and the diversion piece, and just understanding that, I think circling back to, again, I think Terry mentioned before, I think in one of our early meetings, and just I think what Ms. Senator West mentioned just now, the importance of the options of vocational programs, expanding vocational programs, just alternatives for young people out where education, traditional education may not be a means. And so just those vocational programs, alternative educational programs, because right now that is a huge issue right now with the compulsory education law. It's difficult to get young people connected to programs if if they're not in school because of that law. And so looking at, how else can we get them connected, and just looking broader, I think, at diversion. And so I know we're looking at, and a lot of the conversations around detention and committed, but how are we looking before they get at intake with DJS? How do we prevent them from getting into those facilities, providing them with other opportunities?
Just so Heather, so I'm following up. So the conversation about alternatives, including vocational, is not just about within DJS facilities, but you're talking about in the community more broadly.
Really reinvesting into more community resources. So if we don't have as many young people in the heavier and on the back end, we can reinvest those resources on the front end. And so if we do more on the front end, we really want to look and focus on reinvesting on the front end. That really, to me, is a huge goal.
Okay, thanks. Okay, Nate.
Yeah, thank you. I'm realizing all of us do all these Zoom meetings, so we're getting used to using the chat, and then I'm realizing we're on YouTube and no one else can see the chat. So I want to in part kind of say something that was in the chat, but I think Delegate Pippi's point was a really important one, and I think it speaks to the importance though of us of looking at that across the board. One of the things I appreciated from the Court of Appeals ruling is that it asked us the important question that we seem to never have to ask, which was, can young people actually be rehabilitated when we lock them up? Are they getting what they could possibly need in order to in that situation? And all the evidence generally tells us, no, we can do better with young people, even giving the same types of interventions in the community than we can when they're in a facility. And so again, we better have like a really good reason for why it is we're going to rely on a residential setting to provide a set of services that they might be able to get in the community. But I think it goes more than that. I think when we demand evidence behind things that we're putting into programs that are getting small programmatic dollars to do things on the front end, whether it's diversion or whether it's young people who are in the system, we demand so much less about the things that the system does through its operations. Is probation and how it's operating based on evidence that tells us anything about whether levels of supervision matter in that way? Everything that we know tells us, again, it's like supervising kids. And I really appreciate what Betsy said about what we're learning, that we can connect in other ways. It's the support that organizations like Choice, like that Eric is providing, and that probation officers themselves can do through the types of addressing family needs and the needs of young people. It is what Heather's saying of connecting young people with opportunities that build skills and connecting to people who they can relate to, who are helping them. So I think Delegate Pippi is like spot on, that we ought to make sure that the things we're investing in the system work, and that we shouldn't take it shouldn't just be about diverting away from the system or from incarceration. It should be about diverting towards something, towards the things that young people can connect with, so that it's not just about avoiding this negative system contact, but it's about something else. And I think, again, I think at this moment of between this council and knowing the state budget situation that is bound to like haunt us for a while in so many ways, that we ought to be investing in the things that we actually know that connect young people, and not just the things we did yesterday because they're there. And I think that whatever the agenda of this council is, it ought to be along those lines. What are the things we should be fighting for with what probation should be about? What should diversion be about that actually does what we're talking about? If it's about investing in more restorative justice focused interventions that are about repairing harm, so young people are learning accountability and actually like able to move forward, like those are the questions we should be asking. Off myself.
Okay, I'm just going to the other screen. Anyone? I know that Melissa had raised her hand earlier, and Betsy is raising her hand. So, and I'm also cognizant of the fact we have 10 minutes left. So Melissa, did you still want to make a comment?
Yeah, I can make it quick. I was just sort of questioning whether there's any appetite for perhaps looking at changing the statutes around the mechanisms by which kids get to criminal court to take those things that are on the list of excluded, excluded offenses and move them back to a discretionary waiver type of thing.
I see a thumb up from Jenny on that one. And a thumb down from, so it sounds like there is a healthy debate. And
neither of those positions are shocking to Mr.
No,
Schellenberger.
I know that much. Yes, Betsy. Mm-hmm.
So I'm sort of going down the same road that Melissa just went down, but just sort of on different issues. I think it would be interesting, at least for from my perspective, to be able to see and compare the Maryland sort of system to other states as it relates to a few different things. One, how young people get to out-of-home placement. We have a pretty broad system and a pathway, I think, to out-of-home placement. And is that different in other states? Are there sort of other sort of factors that other states take into consideration? And also for sort of violations of probation as well. Just sort of observing the criminal process with the Juvenile Reinvestment Act that went through in Maryland and the process that council went through, a lot of data and sort of comparative analysis was done on sort of should technical violators be able to find their way to incarceration, and should we say certain types of crimes probably don't need to have incarceration as an outcome. And so I think it would be interesting to sort of take the juvenile system through that similar sort of process. And then one last thing, just from my observations through the pandemic and a place where I saw great inequity was really how detention releases were made regarding youth who are charged as adults versus young people who are charged in the juvenile system. Young people in the juvenile system have an access to a pretty strong continuum of alternatives to detention, which they don't have to pay for. So whether it's GPS monitoring, electronic monitoring, virtual programming, in-person visitation, those are all options to help us look at ways we could mitigate public safety when looking at releasing young people from detention if they were charged in the juvenile system. Those options do not exist for young people who are charged in the adult system. If there is an option for home detention, that would be an expense that young person and their family would probably have to incur. And bail really are only the options available. So I think that might be something the council may be interested in exploring.
Great. Okay, I'm just going to, I don't see any other hands. I see Jenny, okay.
I just wanted to second what Betsy just said, especially around evaluating even what the definition of delinquency is or what should qualify a kid for being involved in the system. Just for those who don't deal with it day in and day out, the statute defines a delinquent act as anything that would be a crime if committed by an adult. When you think about second-degree assault, that's a threat to hurt another person. If anyone's walked through the hall of a middle school and not heard 100 kids say, "I'm going to beat your behind," to their friends, both in jest and in seriousness, the fact that we allow that definition of crimes for adults to be applied to childish behavior is a huge driver of delinquency. And I just wanted to second that we should really examine what qualifies kids to come out of the home, given the shifts that we've seen in COVID, given that even just when we talked about the lack of FTAs are no longer driving detention, the idea of importing an adult failure to appear to juvenile court for kids who don't have access to transportation, who don't have access to their own income, who cannot make decisions independently from their parents, is in and of itself just a fallacy, a legal fallacy that we impose on children and use to punish them. And so I just wanted to lift up what Ms. Tolentino raised and say that we really have to look at what qualifies for a kid to be put in cells, right? These are not kids in detention, and youth prisons are in cells. And we need to really examine that deeply and face it head on.
Okay. So any other hands going once? So
Marta, I just
sorry.
wanted to interrupt. I see Eric Ford has a hand on the screen. Just want to make sure
Sorry, Eric.
we weren't missing him.
I did miss him. Eric.
Yes, thank you. I just wanted to make a recommendation about lifting youth voice and maybe the establishment of a youth advisory council for the Department of Juvenile Services. It's something that we've done within the Choice program and had some success. And if we're really serious about providing quality programming, I've heard that theme, it's recommended and said by several people, but if we're really serious about providing quality programming, I don't know how we can do that without having some type of feedback loop or mechanism or counsel from young people to guide the services and the work that we're providing for them. So I think moving forward, it's essential that we have a youth advisory council of some sort to lead us through this work.
Thank you, Eric. Okay, so I think that concludes the adding on options. As the secretary said, we will be circulating a survey, and you will be able to hopefully rank some choices given, these are all really important ideas. And remember, we have this limited period through the fall, and of course it's up to the legislature to figure out whether there will be, another iteration of this council in which some of these, really quite important and pressing issues might be able to be continued to be worked on going forward. So, look for the survey to arrive, and then certainly take some care in figuring it out, in filling it out.
So, Marta, if I could just interject at this point as we get close to the close of the meeting. First thing I want to just let everybody know, Betsy is going to share a slide quickly, and we will send these dates out to everybody. But I want to give the future meeting dates, and we have an aggressive schedule to try and squeeze meetings in before the end of the year so that we have time to review some of these issues, have some debate, and hopefully come to some consensus on making recommendations. And to that end, so these are the dates that we have. We don't need to have a conversation about the dates, but if you have some serious concerns about the dates that we've put up, go ahead and email Jamie, and we can try to make an adjustment if that's possible. But these are probably going to be the dates that we go forward with. And then the other thing that I want to mention is that, Marta, I think you've got two of these items pretty much teed up. The age of jurisdiction issue, you guys have done the research, and the probation duration. And so if I could get, a consent from our group here, I'd like to forward those two items for discussion. So to prepare those two items to have that full discussion with the data that's been requested for our next meeting. And let's take those off the list to vote on, so that, because these are ready to go. And given the fact that we don't have much time, since these are ready, I'd like to tee those up first, and then we can vote on the rest of them between now and the next meeting, and we can organize the priorities from there. Are there any objections to doing this? Okay, great. Marta, did you have any final comments before we wrap up?
Not at all. I look forward to what appears to be a very energized council to getting some good work done in the next few months.
Okay, and I know that we've had some council members that haven't had a chance to speak. Does anybody want to make any last minute comments before we adjourn? All right. Well, hearing none, I will just go ahead and conclude and say that I think this has been a tremendous discussion. I think we've got some really good issues on the table. We have some opportunities here as well to transform our system here in Maryland and really make vast improvements. And I appreciate everybody's time that they've given to this, that the effort that you're making, I see by the questions and the depth that folks have done to prepare for this meeting, the level of commitment that everybody has. I very much appreciate that. And I look forward to seeing you at our next meeting. Thanks, everybody.
Thank you.
Jamie, you gonna let me know when we're off?
We'll do, just told them to take us off of live. I'll let you know in just a sec.
Jamie, just one thing, and I'll go ahead and sign off because I think everybody's off at this point. Do you have a count for how many folks were watching?
It looked like it was around 60 by my count.
Okay, not terrible. Hopefully there were more than one person behind each of those people logged in. Well, I think it went well, and thanks to you.